Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting to the content for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, and videos to assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. I always like to give the disclaimer before getting started that, there's no absolutes in medicine, so we treat on a patient by patient basis. Now, any questions that you see, I have designed them based on the guidelines that are currently being tested on the ANCC and AANP exam. If I am teaching any videos on current practice guidelines, I will say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient returns to the office today for follow up. They are currently being treated with chlorothalidone for the management of their blood pressure. What should the nurse practitioner monitor for while the patient is on this medication? Is it A, monitor weight, as this drug class can cause weight gain? B, monitor electrolytes, as this drug class is contraindicated for patients with electrolyte imbalances? C, monitor for hair loss? Or D, monitor vision, as the medication may cause vision disturbances? Take a moment to tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first to ensure that you are answering what is even being asked. This allows you to slow down and make sure that you're answering what the question is asking you, right? So the stem of the question states, what should the nurse practitioner monitor for while the patient is on this medication? So let's take a moment, take it back, see what medication they're talking about, and then see how to proceed. So the patient is currently being treated with chlorothalidone. So I always recommend when you are receiving medication questions, immediately think of the drug class. If you know the drug class, that gives you tons of answers. If you're stuck, look at the ending, see if there's any clues to help you group it into a drug class so that you're not sitting over here trying to pinpoint every individual medication, right? So we know that chlorothalidone is a thiazide, right? So your best answer here is B. You want to monitor electrolytes as this drug class is contraindicated for patients with electrolyte imbalances. Thiazides cause various electrolyte imbalances, so they always tell you to monitor before initiating and continue to follow those as they're on those treatments, okay? All right, you guys. Question number two for today. Question number two states the nurse practitioner and NP student are discussing fundal height at 20 weeks. What is the appropriate fundal height? Is it A, the pubic symphysis, B, umbilicus, C, xiphoid process, or D, you're unable to measure at 20 weeks? Take a moment and tell me what you got in the comments. All right, you guys. Then the question states, what is the appropriate fundal height? So, all right, the nurse practitioner and NP student are discussing fundal height at 20 weeks, right? So this is one of those just knowledge-based questions, knowing where the fundal height should be. So instantly you should think at 20 weeks, the fundal height should be at the umbilicus, okay? B at the umbilicus, right? And we know at 20 weeks, they shouldn't be way up at the xiphoid process, right? B, umbilicus, and we definitely can measure it, okay? Oh, remember, 20 weeks, umbilicus. All right. And lastly, the nurse practitioner and NP student are discussing the ethical term for truthfulness. What is the appropriate ethical term? Is it A, beneficence, B, non maleficence, C, veracity, or D, justice? Take a moment and tell me what you got in the comments. All right, stem of the question states, what is the appropriate ethical term? Again, we're looking for the ethical term of truth, truthfulness. Is it beneficence? No. That's to do good, right? Like I say, think benefit. B, non-maleficence. No, that means to do no harm, right? Like no malice. C, veracity. Yes, veracity means truth, truthfulness. And then D, justice is for fairness, okay? All right, you guys, I hope you found this helpful. This was a short and sweet and quick one, just more on the knowledge base. I like to kind of throw in those knowledge questions here and there because you will definitely see some of those. My first question was one of the questions from my review book, just to kind of give you an example from that to gauge and test your knowledge as well in various aspects. So again, I hope you found it helpful, but as always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And if you need any of our resources, be sure to reach out to the Nursing Studio at 803 400 6864 or shoot us at email at the nursing studio, the number one at gmail.com. We have online review courses, review books that you can get as an ebook or as the paperback book shipped to you. And both of those links are in the bio of my channel so that you can easily access it along with the website. And we also offer one-on-one sessions to help bring you from unsuccessful to successful. So if you need any of our services, feel free to reach out. But as always, meet me back here. Happy studying. Bye, y'all.